So for the outside of the hip, the lateral hip, the glutes, the IT band, we're gonna lump that together, right? So if you're having any IT band pains, issues that outside of the knee, that's typically involved in the IT band coming up the side of the leg, glute tightness, side hip, sciatic, any of this area here, we're gonna lump that together because you're basically gonna work it all at the same time. If you're using a foam roller, so part one of this is if you're using a foam roller. What you're gonna do basically is take your foam roller, start by simply sitting on it, and say we're gonna focus on the right side to start with. So I'm gonna take my right leg and I'm gonna extend it out, keeping the left leg bent as my little support, my little tripod here. And I'm gonna start by sitting on it, and then I'm gonna lean slightly towards the right side. So that leg that's extended, the side I wanna focus on, I'm gonna lean slightly to that side. This might be a good point for you. You might start feeling some sensitive spots. You can hold here, take a deep breath. Again, let it melt, give it a few seconds. Then you're gonna just slightly roll yourself forward and backwards on this back side of the glute to start. Do that a few times, and then you can start to tilt your body more to the side and roll a little bit towards the outside of the hip, back and forth, and continue getting a little bit further onto the outside of the hip. So I'm gonna use this left leg and kind of turn my body as I start to get on the outer hip. So the place you kind of want to avoid is if you have that bony spot on the very outside of the hip. Once you get there, as I'm rolling up, I'm gonna hit that and I'm gonna come back off of it because we're working on the soft tissue, not the hard bone. So I'm gonna come all the way from the very top, the crust of the hip, all the way down until I start to hit that leg bone on the outside. And again, you can rock back and forth, take your time, come back into the middle, and roll up and down that outside of the glute. Now, if you want to get a little bit more specific for the IT band, in the IT band case, it doesn't feel good to roll all the way down the side of the leg. The muscle portion of the IT band is going to be at the top side of the hip. Beyond that is a tendon. So with any IT band pain, tightness issues, that tendon tends to be a little bit inflamed, a little bit irritated. So simply smashing it and rolling it doesn't feel good, but you can still get an effective release by working on releasing the muscle at the top of it. So that's gonna be here on the side of the hip. So for that, I'm gonna work a little bit more specifically on the side. So I'm gonna come all the way up to the top of my hip bone, all the way down, coming more forward so that I'm solely very squarely on the side of the hip. And again, just coming down, rolling back and forth. Any sensitive spots, again, just pause, give it a second, and let that roll out. So that's using the foam roller on the glute. Now, of course, you'd repeat it on the other side. But if you want to get more specific into the individual muscles that are there on the outside of the hip. So that lateral hip has multiple muscles surrounding where the leg bone connects. And they do all the movements of the leg, including the IT band, the glutes, glute med, all of those muscles come together in this area. And you are working on releasing and self-massaging them all together when you're using the foam roller. But if you want to get more specific, using the therapy ball is where you're going to get the most benefit, especially if you're feeling things or if you're feeling any twinges. Sometimes, if you're getting any sciatic type pain, you can use the therapy ball to more target those sensitive areas. Of course, the one thing you want to avoid is if you experience any of those nerve twinges, numbness, tingling, shooting pains while you're working with the therapy ball, you want to move away from that spot because it's a spot where the nerve is weaving through there and you don't want to further irritate it. So you simply want to work all of the spots that feel sensitive, that are going to give you maybe a little muscle spasm. Again, like in other cases in other areas, work with your therapy ball. When you find those sensitive spots, especially in this area, you can be very tender using the therapy ball. Take a deep breath, release, let it melt, give it a few seconds. This is one area that a lot of people find they need to spend a few more minutes, a little bit longer than you do in other areas of the body, simply because there's a lot of muscles and a lot of attachment. So very similar to using your foam roller, you take your therapy ball, get it in the nook away from the bone where the leg bone comes in, and then you're simply just gonna roll yourself to the side, back and forth, come fully onto the back side of it, up and down, side to side. These muscles go in different directions, so you don't necessarily have to go in the same direction every time. If this area is very sensitive, you may find it most beneficial to start on the back side and roll the hip folding in the direction of the side you're working on, right? And then back towards the center. So if you were to think of that side as a fan, we're simply starting from one end of the fan back towards the other end of the fan by going back and forth. But you can always kind of go across those fibers as well to get different release in different spots. So simply using the therapy ball intuitively in the area, finding those nooks and crannies, you can go from that outside point of the hip, roll it towards the tailbone, back out, back in. You can also go up and down a little bit and kind of work it out that way.